Hey, girlfriend, I am Karen Ray. I am the founder of Fave Lifestyles and the Celebrating 1 Million Women Being Brave movement. And I am so thrilled to be a part of some events coming up. And the one we're going to be talking about a little bit today is the Midlife Medicine, a Menopause and Longevity Symposium hosted by Epiphany Events. Tracy Klinkroth is the organizer of this. And I asked her if I could talk with some of the ladies who are going, and the professionals, the experts who are going to be a part of this symposium. It is a full day with over a dozen doctors and wellness experts, leading speakers, sessions with Q&As and discussions about hormones, menopause, aging, longevity. Oh my gosh, the list goes on. Plus an exhibition area with interactive wellness experiences, networking opportunities, swag bags, and shopping. I'm going to be one of the exhibitors with my friend Kelly White. We're going to have a booth there. We're super excited about that. But I will put in the link for the tickets, ladies, because you don't want to miss out on it. It is September 20th, all day long at in Seattle at SPU campus. So ladies, you do not want to miss out on that. We're going to have some fun. We're going to answer questions. And then we brought Angelina, and Sally, say your last name for me so I don't miss it.
Laforteza.
Yes, it's such a beautiful name. And you tell us a little bit about you and what you do, and then we're going to go into kind of why you are so passionate about women and menopause and all that you do. So tell us a little bit about you first.
Okay, I'm a nurse practitioner and I own a clinic in Puyallup, Washington. I originally started with pre-COVID with IV hydration and urgent care visits going into people's homes. The reason why I'm an NP is because I have a son that's medically fragile. So that's really why I went into the NP role, so I could educate myself. But also when I was 23 years old, I lost an ovary and was hospitalized for a deep vein thrombosis and a pulmonary embolism. I almost died. I was on birth control. I was 230 pounds at the time, and I was sedentary. So my job then, I was a civil engineer. So I was sitting a lot in front of a computer. Yes. So I wasn't active. I ended up in the hospital, and that's when I found out I had a factor V Leiden, which is a blood clotting disorder. So I clot 8 times faster than most people. So that's why there's the big FDA black box warning on birth control pills, like for risk of deep vein thrombosis or like blood clots when you take some birth control pills. So that I'm one of the reasons why that black box warning was on there. So fast forward, I'm now almost 47. Since the time I was 23 until 2 years ago, I was told that I could never have hormone replacement therapy. So I've been without hormones since I was 23 years old, all the way up until 2 years ago. And I've been trying to advocate for myself that entire time to try and get my hormones checked. And nobody would listen to me until I actually sought after educating myself on menopause, because I was basically pretty much forced into menopause back then. And then I went and got certified by a couple of different companies to be a hormone replacement therapy specialist. And then I checked my own blood, ran my own numbers, went to somebody that's certified like me. And I said, hey, can you put these pellets in me, please? So testosterone and estrogen pellets in me. And ever since then, because it's not contraindicated in people that have blood clotting disorders, as long as it's bioidentical. So now I have a huge blood clotting disorder. I'm no longer 230 pounds. I'm like 135. But yeah, it's not contraindicated in somebody like me to have BHRT. So I went ahead and did that and had somebody put the pellets in for me. And I have felt amazing ever since. I have energy, my libido's back. I'm no longer depressed. I'm not on antidepressants or anti-anxiety meds anymore. It's just hormones are amazing. So that's why I advocate for women. Every woman that comes into my clinic, usually they start with me for weight loss because I've lost a lot of weight. And then I move them right over to hormones because they're usually in like the mid 30s to probably, I think my oldest female is 80 years old. So,
oh, wow. Yeah. Okay. So this is going, and you're going to be going more into the subject quite a bit more at the symposium. So we're not going to go a lot into it, but thank you for sharing your story. I mean, I think that is one of the biggest things that, and you and I were talking a little bit about this before we started even coming on here, about being heard. Mm-hmm. So as you were going through all that, and it's years and years and years of having some symptoms, difficulties, no hormones, and all the things that go along with that. What did that make you feel like? And and so it seems like that has just been the drive behind what we do now.
Yeah, that's exactly why I do what I do now, is because I wasn't being heard. I felt very small. Like nothing I was saying mattered. Like I wasn't being heard at all.
Yes.
And so that's frustrating to me.
And girls, so usually here at FAVE, we have these signs that say, I relate. So anybody can relate to this not being heard and having to be the advocate for yourself, but not even knowing what to say or what to ask or anything like that. So as you're being this advocate now for women, I mean, when you start talking about hormones, it's way above me. I'm like, I don't even know anything about it. But so what is maybe one thing for women to, like, maybe what was something that you did for yourself that kind of helped you along the road to get to that place where you felt comfortable maybe asking questions? Because I think we trust the medical staff that they're supposed to tell us what to do, but it's really not that way anymore. So can you talk a little bit about that?
Yeah, so the talk that I did yesterday, all of the women said that the biggest problem that they have is they want to advocate for themselves, but they don't know what to ask.
Yeah.
So, and PCPs and a lot of providers have like a 15-minute window that they have to spend with their patients. So they can't address something as big as hormone replacement therapy for women. So I think the biggest thing for women would be just to constantly advocate for yourself. If you don't get the answers from one provider, get another provider. If and people can always reach out to me. I get random people emailing me all the time about, not medical advice, but recommendations.
Mm-hmm.
What would I do in their situation? Because I fought 20 years to get hormone replacement therapy, and I got nowhere.
Right.
So I'm so excited to be a part of something like this, because it's bringing more awareness to women out there that you really need to be your own voice, or find a provider that will actually listen to you. And it has to be, I feel like it has to be somebody that specializes in hormones.
Yeah. So do a lot of doctors not have that type of training?
They get a very brief introduction to menopause, but not how to manage menopause or HRT in general. So no, they actually have to seek that kind of training. So a lot of, like, I've gone toe to toe with DOs about hormone replacement therapy, and they just don't have the education, and they're not interested. Not just DOs, but I can remember very specifically that provider was a DO. So it just depends on if they sought out education in order to help their patients.
Yeah. So recognizing that maybe not all doctors have that education, what do you feel is one way that a woman could, as she goes in, and maybe she's like me, who I know nothing about hormone replacement. I don't even know if I would ever need it. What would it do for me? Blah, 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 blah. I'm pretty uneducated about all of that because I don't have a real specific need, but maybe somebody does or whatever. So as they're seeking what maybe something that could help them, and now recognizing, oh wait, maybe this doctor might not have all the answers.
Right.
What could you give her to make her feel as she walks into that office, what's maybe one way she could feel seen and heard? Do you feel like?
I don't, there's no real way that a woman can be seen and heard other than repeatedly advocating for themselves, being like the squeaky wheel.
Yeah. And so is there like one first step, maybe seeking out the right questions to ask? Is there certain questions? Maybe is there one question that you bring up to further that discussion?
Probably the one that would get most attention is painful intercourse, vaginal dryness, because then they would actually get referred out to maybe an OBGYN or yeah.
So one of this, what I'm hearing you say is it's not maybe necessarily, find maybe the topic that would get you referred out, but it's that get referred out.
Yes.
So that might be something you might be seeking.
Mm-hmm. Yeah, because a lot of PCPs just don't have the time and they don't have the education to manage, because women's hormone replacement therapy is much more intense than men's.
Mm-hmm.
Because for me anyways, as a provider, I look at the women as a whole. So when I check labs, I address everything on the lab that is out of normal range for me. not what's out of normal range on the lab values. So
Yeah. Oh my gosh. I mean, there's so many that we could have a long talk about this, but we're just going to our little conversation because, you talk about, I think one of the things that I'm noticing in you is that passion behind to help these women. So what is your vision? What is your vision for these women to help them discover what is best for them? Is there something that as you look forward that you are excited about as we look at this topic and start talking about it and having it open up?
I look forward to women feeling better about themselves, like in general.
Mm-hmm.
So without hormones, women just feel miserable, and menopause is natural,
Right.
but going through all the symptoms and suffering, that's not natural. So we have things out there that can help women feel better, and not have to take antidepressants or be on any other meds. Hormones are natural. So I'd rather introduce natural medicine to women so that it's more natural in their body rather than trying to mask their symptoms with some other medication.
Yeah.
Antidepressants are the first ones that come up because when women go in and they say, I'm sad, or I don't feel like getting up in the morning anymore, then that's the first thing is a PCP will say, well, you're depressed. So we'll give you an antidepressant. So I prefer not to do that to women.
Yeah. So it sounds like questioning what you're being told. Is that the right avenue, or there are some maybe some other options? I mean, even with myself, I was diagnosed with osteoporosis.
Mm-hmm.
So then as I'm starting to learn more about hormones, I'm like, well, was that the right course of action? Now I'm starting to ask more questions. So as we talk to people like you, maybe we can formulate some other questions that we should maybe be asking our health providers. So
Yes.
yeah. So I'm so glad that you're bringing this topic. And the other thing that I think that is really important, that just even coming here right now, I have been scared to ask questions, to be quite honest.
Yes.
Because I don't know anything about hormones. So how do you know where to start? So what's something you can leave the women with? Maybe what might be the first question you could maybe even ask yourself, and so you feel safe and comfortable even bringing this topic maybe of hormones to the table?
I think just being able to ask, not necessarily say that you have this symptom, but being able to ask a provider, why at this specific age, why would I be feeling like these certain symptoms? Is there anybody you can refer me to that specializes in women's health or hormone replacement therapy? Because a PCP just does not have the time for that. Just really doesn't. So if a woman can just ask to be referred to somebody to talk about women's health issues rather than trying to talk to it about their PCP, that's probably the quickest way, instead of trying to go after their PCP and ask all these questions that they probably don't know the answers to.
Right. And that's what I think I love so much that Tracy is doing, and bringing these experts together, because whether you know a little, a lot, or nothing at all like me, you can go and start researching, discovering with the experts, and have an opportunity to ask questions. Because there's going to be some Q&A sessions. And I think you just need this safe space to be, and not feel pressured like you're under a time clock and you've only got 15 seconds to blurt everything out. But you'll be able to hear the concerns of the other women who are walking through it too. And I think that is what is so important about having this symposium and bringing these experts together. So as we tell us just real quickly what your topic is that you're going to be covering, and what would you like to leave the ladies with as we close out?
Actually, the topic I'm covering is more of my struggle with seeking HRT for me specifically, because I understand what it's like as a woman to be trying to get help and nobody's listening to you. And that's what I do for a living now. I help women. I don't help them advocate because they're coming to me and I just help them. But I always really stress, you need to advocate for yourself. We're women. We have voices. You just need to be louder.
Okay, girls. And have that confidence in advocating for yourself and asking questions. Yeah, because so many of us grew up, we weren't supposed to ask questions. We're
Right.
just supposed to listen to the authority and take that they know what they're talking about. But again, girls, not everyone is trained in those specific things in the menopause. So I'm so glad that we had this opportunity to chat. Ladies, reach out to Angelina, see how she can help you or answer your questions or redirect you to what that is. And come visit us at the symposium on September 20th at SPU. Get your tickets. I'll put the ticket link in the comments here. And I hope to see you all there. And Angelina, thank you again for joining us.
Thank you.
Alrighty. Bye, girls.